So how's it going? I want to clearly walk everybody through what a office that's in compliance looks like. I get this question asked a lot, especially when it's somebody's getting close to having to do a survey. It's like I'm panicking now. Is my office in compliance? So let's walk through this really quickly. First thing you're gonna see on my door, and of course I run a personal injury clinic and a home health care inside of here. What you're gonna see, first thing the state looks for is your hours of operation. Hours is Monday through Friday, 9 a.m. to 5 p.m. And as you can see, all the numbers they need to be able to contact us. This has to be clearly displayed on your front door. You walk into my office, and the second thing they're going to look for, second two things, and again, your office doesn't have to be this elaborate. You can actually run this out of your home. My office is pretty big because I do multiple things out of this specific location. But one of the things they may look for, based on your state, would be your labor laws. So the state and federal laws have to be clearly displayed as well. And then your license. And as you can see, our license is licensed for three categories: hospice, LHHS, which is your skilled private duty nursing. We specialize in pediatrics with this specific agency, and of course, personal attendant care services. So you also want to have, again, this is just extra, but a good setup, good phone system, either Ring Central or Uma or whatever. Your fax scan copier, right? All in one combo kind of machines. We have multiple. As you can see, my office manager was on HHA Exchange earlier, probably doing some maintenance on some of the billing or something like that. We personally also have, brochures and other stuff clearly displayed in the office. But besides that, let me show you other things that the state looks for. So, your heartbeat. This is typically where I hang out at. This is my space. But as you can see, we have multiple doors here with multiple things going on. So, and we'll talk about that on a later video. For now, I just want to walk you through this compliance situation. The next thing you're going to notice is that the state is going to look for these policies and procedures. As you can see, all of our stuff is pretty thorough. I open this file cabinet up, and there's everything here, right? Everything from the safety data binder, therapy manuals, your on-call logs, policies and procedures manuals, volume 1 and 2, and we also have a separate pediatric manual, policies manual, your employee application packet, ethics committee, your MSDS satisfaction surveys, your complaint log, your job descriptions binder, your administration information binder, IV therapy, right? Your infection control binder, your QAPI, your disaster preparedness plan binder, everything is there, right? And so you want to be thorough because the state's going to look for that. And they're going to hold you to whatever you say you're abiding by, or they're going to hold you to whatever those policies and procedures say, because that's the heartbeat of your business. They're going to look for these file cabinets, right? These file cabinets need to be locked, people. So need to be able to have a way to lock them and secure client information and client files. Of course, we have a lot more going on here. So I'll show you some other little things that we do in the office. So this is typical of my DON and my administrator hang out at. And you don't have to be this elaborate. But they typically have all of their important information already on the wall, right? Important contact numbers, important points of contact when it comes to reaching out to certain MCOs or HMOs. And they also have things like this, again, on the wall. Our information already there. So if somebody's asking what's your fax number, they don't have to try to memorize it. They can just look on the page. All of the port intakes, right? APS intake, right? Adult Protective Services, state intake, regional nurse, all of these people, right? On the already displayed there. If I walk back to the front, you'll also see where my billers billing and coding people typically hang out, and my office manager, and you'll see that they also have certain key things up here, such as the hourly rates for HMOs, right? The modifiers as well as the rates for various insurances, so that again that stuff is readily available and on hand, and they don't have to try to guess about it. So just understand that the main thing the state's going to look for when they come through that door in terms of your checklist is your business information clearly displayed on the front door, your license clearly displayed when they come through the door. They need to be able to see that hung up somewhere. Your possibly your labor law poster, and then the office set up nice and neatly in terms of shredder, copy scanner, fax, computer, all of your workspace, right? And then the main thing they're going to look for is that file cabinet being locked, with all those client files secured, and then of course your policy and procedures manuals along with your copy and your emergency preparedness plan. So if you have those things pretty much together and you know that they're in compliance, the only other thing you have to worry about is your employee files and your client files, to make sure that your client has signed everything they're supposed to sign, and that everything was left with them that's supposed to be left with them and brought back to the office that was supposed to be brought back to the office, because they will go through that, call a couple of clients, maybe even go visit them. And so you want to make sure that all of that all your I's are dotted and your T's are crossed. Besides that, your employee onboarding, and in an employee file, I'll start with the administrator. All you need to know is that you need to have, and I'll include the checklist in the description. But all you need to basically have is the application. So we're talking about administrator first. All you need to have basically is the resume, job application, referrals, their clock hours, their modules, any credentials or certifications they have, whether it's a nursing license if you're doing skilled, their CPR cards and certifications, etc. And then they also need to make sure that the OIG is run through they're ran through the OIG, the database that determines whether they can be hired, right? So that do not hire list, whether it was exploitation, neglect, or abuse, but you have to run that along with a background check, and that's separate. So just understand the state looks for all of that, and all of that stuff should be in their file along with a clear job description. So every job they hold, you have to actually have that description also in their binder signed, saying they understand their role and responsibility. And so besides that, the state is going to also look for, have you done your evals? Have you done your annual meetings? Have you done your QAPI meetings? Right. So all of the documentation is important, because in the eyes of the state, if it's not recorded, it didn't happen. So just giving you an idea of what this should look like. You don't have to have this much space. Again, I run a whole lot of businesses and do a whole lot of different things, but like I said, you can do it from your own home but you have to carve out a specific space that says this is my home office, for when the state comes, they know how to separate it out and know what to look for within that space. Some states you have to have a brick and mortar. Texas just allows you to do things a little differently. But just make sure that you have your little small office space and that everything is in compliance per what I just discussed. If there's anything else I left out or not thinking about right now, somebody can come in and add to this. But let's grow and let's get to this money.